Now, in this session, we will explore the various methods for selecting the most suitable lenses for patients with corneal opacity, considering that each individual and each patient has highly varied eye conditions, making it essential to perform customized surgeries tailored to their specific needs. To illustrate this point, I have brought a specific case to discuss. The patient is a 59-year-old male who has corneal opacity. He also had high myopia. There was anisometropia with different prescriptions in both eyes. In addition, the cataract in the left eye has progressed further. Additionally, the corneal opacity in the left eye was more severe. Now, when we look at the refraction, the right eye falls under the category of high myopia. The right eye has about -6 diopters of myopia. The left eye has -3 diopters of myopia with 3.5 diopters of astigmatism. The astigmatism is quite severe. The corrected vision in the left eye was unfortunately only about 0.6, which was quite low. Now, considering how we should approach the surgery for this patient, let's first examine the condition of the cornea. The left eye was in generally poor condition, with a significant white opacity present. Since it extended to the central area, there was vision loss due to the corneal opacity and also due to the cataract. Well, addressing this corneal opacity is not feasible without performing a corneal transplant, so that issue is I determined that a transplant wasn't necessary. Let's start with the cataract surgery. So, which lens would be best? When there is opacity in the central area, predicting refractive power becomes difficult. Furthermore, since lenses with intricate optical designs can introduce many variables, we chose the Clarion monofocal toric lens to effectively address and correct the significant astigmatism in the patient's eye. For the right eye, although there was some opacity in the peripheral region, the central area was clear. And based on the corneal topography examination, since there were no significant irregularities in the corneal curvature, I believe the Puravision lens could be suitable for this eye. So we designed it so that the right eye would primarily be used for seeing and the left eye would assist. Alright, if we look at the corneal topography of the right eye, the center appears clear, but there is some opacity here. Consequently, the curvature is slightly different. However, since it is slightly off-center from the pupil, I determined that the Puravision lens could be suitable for this case. As for the left eye, it presents a very complex and diverse color pattern. The colors are red and blue, and they change in a very dense and diverse manner, making the corneal topography quite inaccurate. When there is corneal opacity, the process of analyzing light transmission as well as light reflection to depict the curvature of the cornea becomes quite irregular, and as a result, the analysis is not accurate. As a result, it's challenging to rely on this data, and even if we do, the inconsistencies make it difficult to fit a conventional lens. So we can either use a single focus lens or just correct the astigmatism. This patient saw much better when astigmatism was corrected, so the current glasses include astigmatism correction. Based on the refraction test, aligning the astigmatism axis precisely allowed for better vision, so we used a single focus lens that only corrects astigmatism. On the left eye, it is evident that the high-order aberration levels are markedly increased. High-order aberrations are irregular astigmatism. These cannot be corrected with glasses or lenses. Alright, when we examine the interior of the eye, it's evident that the optic nerve and retinal vessels in the left eye are less visible compared to the right eye. This is partly due to the corneal opacity. There is also a component due to the cataract, which should improve. So this is before cataract surgery, and this is after. You can see the color difference. Overall, the increased redness is due to the retina becoming more visible after the cataract was removed, but the cloudiness in the central area is a result of the corneal opacity, which is an unavoidable condition. Despite this, there can be an improvement in vision as we have corrected for astigmatism and other refractive errors. Let's examine the corrected vision. Here is the state before the surgery, and this is after the surgery, showing the diopters. For the right eye, we minimize the prescription to improve distance vision, while the left eye follows the monovision concept. Originally, the target distance was around this range, but we adjusted it to about 50 centimeters. Therefore, the targets for each eye are slightly different. The patient reported excellent distance vision, but slightly poorer near vision, which is understandable. Originally, the patient had high myopia and was used to seeing close-up. We adjusted for better distance vision. Since the function of the left eye is somewhat diminished and set for near vision might be relatively weaker. So the vision was 0.05 before surgery. Now, the right eye is 1. The right eye achieved 1.0. The left eye was around 0.3. This is expected since the left eye was adjusted for near vision. Currently, if you observe the left eye, the severe astigmatism of 3.5 diopters has been significantly reduced to just 0.25 diopters. Thus, by employing a monofocal toric lens, we managed to effectively address the astigmatism, leading to a notable enhancement in the patient's visual acuity. It reaches up to 0.7, so you can see that a significantly effective vision is still achieved. After the surgery, the cornea. Upon reviewing the patient's condition at a later time, I determined that the selection of the lens was indeed appropriate. For those who prioritize near vision, we could adjust the right eye for close-up vision instead of distance, but they would then need to wear glasses all the time. When you take off your glasses to see up close, you can see well. Since the patient preferred not to wear glasses, we thought multifocal lenses might be difficult to adapt to. Pure vision in one eye, Clarion monofocal toric in the other. The results were satisfactory. I think the results were good. The patient was quite happy. In the past, there were medical conditions that resulted in corneal opacity during childhood. This condition is called trachoma. It's also known as doragome. The choice of lenses can be influenced by the extent and location of corneal opacity. The selection of lenses can vary depending on the degree and location of the corneal opacity.
Yes, everything went very well. If you trust us and visit, we will do our best to serve you. Thank you.